breaking news.
Breaking news to tell you about. We have learned just a few seconds ago that test results on the New York City Doctor, Craig Spencer, have in fact come back positive for Ebola. CNN's Elizabeth Cohen joins us now with details. So, Elizabeth, do we know, I assume these are preliminary tests. There are going to be more tests, but right now the initial test is that he is positive for Ebola, yes?
Yes, and I'll tell you, Anderson, those initial tests, they are usually right. They did the exact same test that they will do here at the CDC. I've learned that a specimen from the CDC, from Dr. Spencer, will arrive at the CDC shortly after midnight. It's being flown in. There's a team here waiting for it. They'll do the same test. They'll just make sure that it's correct. But usually, if it's positive at one of these local labs, it usually is positive here.
I also want to bring in our chief medical correspondent, Dr. Sanjay Gupta. So, Sanjay, obviously, and you're joining us on the phone, obviously this is going to be a big deal, a big test case for New York City. It seems like the doctor, as soon as he noticed any symptoms, telephoned authorities, and it all seems to have been handled as authorities would have liked from the moment that authorities and ambulance first showed up to bring him to Bellevue Hospital.
It certainly sounds like that, Anderson. And, yeah, as Elizabeth said, I think this is almost certainly going to be a positive test. It'll be confirmed shortly by the Centers for Disease Control. But he did the thing that you're supposed to do, which is, it sounds like, when you develop symptoms, to go ahead. He called the authorities, was rushed to Bellevue Hospital. My understanding is placed into isolation. And remember, that's such a crucial point. Even before tests come back positive, you want to treat the person as in isolation to make sure they can't potentially infect other people. It is important to note again, Anderson, as you and I have discussed, that someone really does not transmit the virus until they become sick as well. And I think that's going to be an important point to remind people of, but also to remember in this case as the authorities try and outline his last couple days as well, Anderson.
Sanjay, I've already received tweets from people saying, well, why didn't this doctor, when he came back from Guinea, isolate himself for 21 days, even if he was feeling fine, just out of an abundance of caution? I'm not in any way pointing fingers at this doctor. Is that something that's reasonable to expect people who have traveled to West Africa to actually do?
Well, you certainly have heard a lot of that, and I think there's been a lot of confusion around this point because you've heard about people being quarantined who aren't sick and put into isolation. The science is, I think, really important here, and I think it could provide some sense of comfort, and that is, again, that someone should certainly be monitored, and what that means is they take their temperature a couple of times a day, make sure they're not developing a fever, because that can be one of the first signs that someone has developed an Ebola infection. But unless they are sick, they are not going to spread the virus. So if a quarantine is being done to try and protect the public's health, it really wouldn't matter in this sort of situation. He wouldn't need to be quarantined because he's not a threat to the public's health. As soon as he or anyone develops symptoms, if there's a concern about an Ebola infection, they should do what it sounds like he did, which is to call authorities, go to the hospital, be put into isolation, and obviously mitigate any chance that he could have spread the virus to somebody else.